So hi everybody, delighted to be joining you all today. My name is John O'Connell, Director of Strategy and Service Innovation for SCW. We're also proud sponsors of Open Data Saves Lives. So thanks for the kind invite to be able to present to you all today. And I'm really keen to probably share with you some, what I think is quite some innovative thinking that's been developed with the team at NHS England and part of Analyst X, which is Future NHS. It's regarding the Accelerator challenge, where we're looking to accelerate safe and effective adoption of AI in healthcare. It's part of what we're classing as the Data Saves Lives Reshaping Healthcare strategy that's been published. And it's also part of the Analyst X work that we are looking to connect and empower analysts community through developing what we're classing as an online analytical hub, giving them a space to be able to share their learning, educate themselves, and promote and endorse good outcomes and such of analytics in the wider determinants. So we move forward. Why are we doing this, and why is it important? And I thought this slide was quite interesting. A bit of a story from my perspective. When I was travelling around the SCW patch, come across quite a few analysts that were kind of really interested in doing advanced data analytics. They were kind of what I class working in Horizon 1 space, which is the current state of play. They were working on what we class as descriptive analytics, very much around business as usual and working with Excel. But the passion that they had was kind of in working Horizon 3, the future state. They wanted to look at and work towards what we class as advanced, prescriptive and predictive analytics using kind of AI and machine learning and tools such as Python and R, and that was kind of where their passion was. But what they were basically saying is that's their passion today, but they didn't have anything to do in their day job in a sense to apply the newfound skills they had. And sadly, what tends to happen is you'll get people that will learn these new skills, but either leave the NHS and move to industry, for example, because they find an opportunity to apply them. So the challenge out to us was kind of how do we change that? And we come up with the idea of working in what we're classing as Horizon 2, is developing something else which I'll gladly come back on, is the Data Analytics Passport and the Accelerator. And the Accelerator is going to be an environment that we're going to create that allows people to safely play and use these new tools and technologies in a safe space to help supercharge what we're calling the adoption of AI in healthcare. So what's the concept? The Accelerator concept is something that we class as kind of learning by doing. First and foremost, we are really strong advocates of enabling collaboration, but allowing people to connect virtually across, and it's really important, healthcare and care, but most importantly, making sure we bring on board industry partners because they can help push us farther than we think we can go today. So galvanizing the wider community as a whole. Secondly, we need to create kind of an environment that allows upskilling of analysts, giving them access to new learning modules that come through, but also giving them sort of some steer of where their future career development trajectories would likely go. And finally, on the third piece, when they get involved, is give them recognition, provide national recognition of some of the great work that they do, and enable career mobility across health and between health and care, and also into the voluntary sector. And it's all in the work towards professionalisation as analysts as a profession. And the benefit of this, we think, is going to feed back exponentially back into these emerging ICSs and the new systems as we move forward. So it's a really, really exciting opportunity to be part of this new development. And this is kind of what I suppose the high-level vision looks like. And I'm going to be talking predominantly now in this space here, the AMX Accelerator Challenge. But you'll see as well that at the centre of everything that we're doing is basically creating what we're calling the Analytical Passport and Profile that allows people to do learning, record their sort of learning journey, gain digital badges, and learn new technologies and new skills. We've also got a peer network which we are developing as well, and also you've got professional recognition from the likes of AFA and others. But in this space here specifically, we want to create an environment, a framework, and an ecosystem that allows people to come together to work on these new things. It's all in good learning, R and Python and wanting to apply those new skills, but how do you apply them in health and care? So what we are thinking of coming up with, excitingly, is an accelerator challenge. And the challenge looks like this. It's a typical challenge that would start with a launch event, very much like I'm talking to you guys today, a call to arms. And it would end with a winners podium, and there'll be lots of different winners, basically from storyteller, use of AI models or advanced modeling, best use of visualization, best use of storytelling. And the idea is that we'll do is the call to arms will provide a challenge, and it could be around, how do we help and health economy recover and restore using different data sets and using technology to understand, what we can see from these new insights by linking data together. Each team will consist of between sort of 7 to 8 members, including a leader that will join them. So it doesn't need to be one organization. It could be a whole hybrid from different industries coming together. But most importantly, we want each team to include an apprentice. So people get upskills, can see what's happening in that, and then hopefully start joining other challenges as they come through in the year. But it allows people to sort of learn as they go along. And then what we mean by reward and recognition here is basically that once they've gone through and they've been part of that Accelerator challenge, they get a digital badge basically for being part of that team and winning as they go through. But it'll allow us to sort of promote learning as we go along in a sense, and we're going to have different sponsors joining us as well. So the likes of AWS, Google, Microsoft are going to be hopefully giving us access to some of their sort of new tools and expertise as we move along. So the idea being here is that we learn together, and the challenge then will be able to disseminate, should we say, valuable experience across health and care together. So really exciting opportunity, and what I'm encouraging people is to watch this space, because we'll hopefully start hearing some stuff towards the end of this year. And just to say as well that the data sets in there will be admitted patient care, emergency and A&E, and mental health minimum data sets. And ideally, the vision is that we can start bringing in some sort of primary care data sets. But the data in its scope will sort of increase exponentially as we go along. So what does it look like, the proposed challenge? We are aiming to do the pre-pilots around about December into January next year, for 3 months up until February, just to test the infrastructure. And then we launch the first pilot in around about March, April time. And that will be a call for teams to sort of join up and sign up and join the challenge. So what people get access is to an infrastructure, which is a back-end system that will give them the tools they need to apply. They'll also get access to systems like tools like R and Python. The challenge itself is going to run for around about probably 12 weeks for 100 users. They'll get full user support, and they get data model training on what a model looks like, and also access to all the different data sets and reference files as well. We also know that this doesn't come without challenge. So we think one of the key challenges we're going to have to come across is the people challenge. Getting people to release time, because we know the NHS is busy trying to support recovery and restoration. But equally, we need to know that if we don't provide an opportunity for analysts to be able to operate in this new space and apply their new skills, we're not going to be able to develop our future workforce. So the idea being is here we're going to put something together around a release to learn charter possibly. And the idea is that when people join this sort of 12-week program, they get assigned a mentor, they get a release for a resource commitment, so they're able to join the actual journey for the number of weeks. But yeah, really, really exciting opportunity for everybody to sort of look out for. And then finally, what does success look like for us? We're hoping to, in the first year, get 80 analysts through a quarter, going through the Analyst X program. And that ideally needs to be a mix of local authority, health and care and industry working together as blended teams, and allowing for strong development of private and public partnerships, but also, most importantly, to accelerate what we're classing the safe and adoption, should we say, of AI within healthcare. But the idea thing for us is that we get better outcomes from patients by doing this and learning together, and we have opportunities for analysts to be able to work across different domains and different disciplines. Better use of data goes without saying, and then the idea being as well that once we start developing some of these models, they could be scalable. We could share these models back with emerging ICSs. But the most important thing for me, I think, is we get an upskilled analytical community, and we move up that ascendancy model, and our staff can move away from descriptive analytics to predictive and prescriptive analytics. So they get an opportunity to play in that proper space with real live data and answering some of those what we class as kind of wicked challenges. So very similar and very aligned to what you guys are doing, that open data saves lives. But they're really, really passionate about this. I think it's an exciting opportunity. I just encourage anybody that's got any thoughts and would like to help support the enablement of this is to get in touch. But thank you.